Hi, I'm Devaney Christensen,
And I'm Kelsey Sanner.
and we put together this presentation on infectious mononucleosis to kind of educate everyone about what it is and what it does to our bodies. I had it last year, and so this helped me understand, so we hope it helps you understand.
Infectious mononucleosis, according to the National Library of Medicine, can be caused by two separate viruses, the cytomegalovirus, or CMV, and the Epstein-Barr virus. CMV is rarely the cause of mono, so today we will mainly focus on the Epstein-Barr virus. The Epstein-Barr virus is one of the most common viruses known to infect humans and is one of the 8 herpes viruses. Pictured in this slide is the Epstein-Barr virus. While this one is more of an animation of the virus, it does a good job of showing what it looks like in the three-dimensional form. This one on the right is more what you find when you look into a microscope. The spikes you see are glycoproteins. They are on the outside of the protective envelope. Their function allows them to recognize and attach to host cells. This outside ring is the envelope which the virus develops when it leaves its host cell. Right here you find the core, which is surrounded by the capsid. The capsid serves to protect the core because that is where the genetic information is stored. The Epstein-Barr virus genome is double-stranded DNA, which is shaped like a donut. Inside the core, you can find the DNA wound around specific proteins. This diagram is a simple and clear illustration to help review the main points we just discussed. Just remember that the virus is enveloped and that there is DNA found in its core. This is just more information, but these are what host cells look like after they have been infected.
Okay, so now we're talking about the reservoir, and basically this just explains where the Epstein-Barr hangs out in all of its spare time, and that is humans. EBV is spread by and through humans because it's just where it feels safe enough to build its family, basically, and EBV can only survive for a few hours outside of its human reservoir. So when you've come down with something, you probably don't care as much whether the virus has an envelope or not, but you will probably care about how terrible you are feeling. So now we're going to discuss the signs and symptoms of this disease, but first let's review the differences between signs and symptoms. So signs appear during infection, but it is something that can be observed by someone other than the infected. So basically we can see what's going on. In general, these things are things like a rash or bloody nose, swelling at a point of injury, or a missing limb. Symptoms of a disease are what the infected person experiences, but only they can know about it, so it's subjective to them. These might be things like a sore throat, tight chest, growing pains, or a heavy heart. As far as infectious mononucleosis is concerned, your symptoms will probably include a sore throat, headache, muscle weakness, pain in the upper stomach, fatigue, chills, and loss of appetite. It is also important to note that everybody symptomizes differently. So when I got mono, my husband and I got it at the exact same time, and my little brother did too. So we probably all got it from the same place. But my husband, he experienced it more of like the chills sort of feel, and I didn't really get a lot of chills, but I had excessive fatigue, and that's kind of one illustration of how people symptomize differently. So many people have the Epstein-Barr virus, but not everyone symptomizes either. In fact, most people don't. By the age of 4, up to 70% of children have been exposed to the virus, and by ages 30 to 35, 95% of people have been exposed. And the people who generally symptomize the most are teenagers and young adults, and it can affect people more severely than others. Kelsey has a story.
I have an aunt who is 50 plus. I'm not exactly sure. But she had mono as a young kid, and she has had the Epstein-Barr virus affect her life ever since then. She's a school teacher, and she'll feel really, really great for a period of time and commit to do these certain things, and she'll come down with her Epstein-Barr virus will affect her, and she'll be wiped out and in bed for a week. She can't get out of bed. So it doesn't just affect young people. The Epstein-Barr virus can also affect older people.
And kind of just to give you an idea, so after you've been exposed to the Epstein-Barr virus, it can incubate in you for 4 to 7 weeks. So basically it's there, but you're just not feeling it. And then when you start to symptomize, they can last anywhere from 4 to 8 weeks. But fatigue has been known to last, well, in Kelsey's aunt's situation, for like it's periodic throughout forever, basically.
Yeah.
Generally,
on and off.
Yeah.
Throughout life for her.
But for most people, it can last anywhere from just like a month from when you got your first symptom to like a year and a half later. Yeah. And so when you go to the doctor, these are the things that the doctor will be able to see. And those include the fever, swollen lymph nodes, enlarged spleen, enlarged tonsils, a red and coated throat, rash, and weight loss. And right now, I'm going to shout out and say that the next couple slides, viewer discretion is advised, because we're going to show you some of the signs. And so if you have a weak stomach,
they're pretty ugly.
Yeah, they're a little bit intense. So on this slide, here is the typical throat of someone who has mono. You can notice the swelling of the tonsils and the overall red appearance. And the tonsils are also coated.
It looks really similar to strep throat.
Yeah, it is very similar to strep throat, which is kind of why lots of times when people get mono, they think that they have strep throat, is because it
correlates.
Yeah,
it's together.
Super similar to it. But it's important to know that if you treat mono with antibiotics, like you would strep throat, a rash can occur just because you don't really need the antibiotics to treat the virus. And on this slide, we can see a picture of the rash. And I know I just said that, like, if you treat mono with antibiotics, you can get a rash. You can also just get a rash if you don't treat it with antibiotics. So just be aware of that. And then on the picture on the right is an example of a swollen lymph node. And those can be anywhere, like in the front of the neck, in the back of the neck. This one is pretty clearly visible, but sometimes you can't actually see them when you have mono. Like, it's more, you just kind of feel it and you know.
And they're tender to the touch.
Yeah, they're tender.
For the person that's sick.
Yeah, and sometimes it can make it hard to swallow too, just because they're so swollen and whatnot. And these are other less common symptoms and signs of everything. But you might happen to notice them. So there's jaundice, which affects about 3% of those who show symptoms, nosebleeds, chest pains, and shortness of breath, swollen of liver, and a rapid heart rate. And did we talk about, you can also get an enlarged spleen, and not everybody gets an enlarged spleen, about 50% of people do. But that's important to know because that can...
There's a sign or symptom.
Yeah.
All right, now we're going to talk about transmission. With how terrible this sounds, it's important to know that how the Epstein-Barr virus is spread, and how you can avoid it if possible. So a lot of people that have the Epstein-Barr virus, there's only a period of time where they're actually contagious. No one knows exactly how long that period of time is or when it is, so you just need to be careful if you know of someone that you're close to and that has this. So it could be anywhere from the incubation period up to 18 months after the symptoms occur. If you're around someone who has it, you need to know how it's transmitted through the bodily fluids such as saliva, semen, mucus, and blood. This is why mono is nicknamed the kissing disease. More than likely, though, it will be transferred through someone coughing or sneezing and their saliva getting on you.
Kelsey just touched a little bit on how mono is called the kissing disease. So one obvious way of prevention is just to know who you are kissing, but sometimes kissing might be worth it. At this point in time, there are no vaccines for the Epstein-Barr virus. That's partially because it's just one of those things that everyone gets and it doesn't really affect most people. It's not really on the high priority list. It is best if you just practice good hygiene and wash your hands. We all know that most diseases are spread through not washing hands. And so also while here we are in our little LDS community, this isn't so much of an issue, but as a lot of us are going to be in a clinical setting one day, it is important that we are aware of this and that so that we can educate those who might not live the abstinent lifestyle that we do. But it is to just practice safe intercourse. And so it is important to touch on that point just because it's a real prevalent issue in the world today. There's also this theory to expose your children at a young age to the Epstein-Barr virus because children don't experience symptoms like teenagers and young adults do. The idea is to get them infected before it actually hurts them. This theory isn't necessarily doctor approved or disapproved. So kind of please be safe and do what you think is best for you and your child. So when you go to the doctor, doctors can't necessarily do anything to help you get over it quicker, but it's still important to get tested. So by getting tested, you know what you're dealing with and can plan your life accordingly. For instance, I was able to take a semester off classes because I knew that I was going to be sick for a while and my grades would likely suffer. So it was nice to know what was going on. It also helped me to get grades appealed when I needed to. The easiest way to diagnose mono is by a monospot test. All this is a little prick in your finger and the blood will either clump or it doesn't clump on the tester. So if it clumps, that means you tested positive and the clumping is in response to a heterophil antibody that is present in your body because of the Epstein-Barr virus. So if it doesn't clump, the antibody isn't there. You can have a false negative though, because the monospot is only effective during a certain period of symptoms, usually only about 2 weeks after they initially come on. And if this is the case, you'll be given the EBV antibody test. During this test, one small vial of blood will be taken from you, which will test for the EBV virus. And based on the markers on the virus, the doctor can tell whether the virus is active or not, and when it was that you were exposed. Another theory is that you can diagnose off signs and symptoms. That can be difficult though because everybody symptomizes a little bit differently. So for the best accuracy, you should just get the blood work done. We brushed on this a little bit earlier, but antibiotics aren't to be used for infectious mononucleosis, and antivirals also don't work. Because of this, it is best to just treat the symptoms like you would any other flu virus. So things like take ibuprofen or acetaminophen for pain, drink plenty of fluids, and rest. Your body will most likely be exhausted and it's best to listen to it. Sleep all you can. Another thing to note is that it is important to abstain from any intense activities, especially contact sports and heavy lifting. Failure to do so might cause your enlarged spleen to burst, and then you will have a whole different set of problems to deal with.
We hope that you have enjoyed learning about mononucleosis and the Epstein-Barr virus and how you can avoid it if possible, and be careful who you kiss.